Matthew Holt. You are not going to believe what has happened. Primary care appears to have jumped the shark because there is a deal in this episode of Health in 2.0 in which the investors on the round, probably my favorite group of investors ever. We've got Khosla Ventures. We've got Mark Benioff, CEO of Salesforce. There's Softbank money. And as if that was not enough, halftime Super Bowl sensation The Weeknd is in this round.
Oh, I'm blinded by the light. Da, 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 da. That Weeknd? Yeah.
That Weeknd. It can only be the March 12th episode of Health in 2.0.
Well, that's cool, Jess, because these days you have a SPAC, you have to have a celebrity. If your name's not Jamas, right? Then you have to have Alex Rodriguez or Serena Williams, or I'm sure Tiger Woods is in a bunch of them. Who knows? Or probably would be if he was in the hospital. So why not get him in the funding round?
Right? I can't believe this. We're getting like celebrity investments. Unreal.
Well, it's been going for a while. I remember way back when I had a thing at Health 2.0 when I forget who was invested in, but it was like a fake doc. It was like a sort of online doctor service, and they had a real fake doctor. They had McDreamy or McSteamy or one of the ones from what's that show?
Grey's Anatomy.
Grey's Anatomy. One of those doctors invested in around about 5 years ago. And I had him on the I had him up on the PowerPoint at Health 2.0. So
Well, I can't believe like Mark Cuban was walking around Health the last time we were in person at a Health. I was jazzed about that. Now The Weeknd? Like, what?
I only know the one song I told you. I'm not sure there is another one. All right, we should go do this.
I can't feel my face when I'm with you, but I love it. Yeah, no.
Oh, that's him too? I did hear that.
You don't know that song? Oh, that's him too? You have no idea what I'm talking about. Get your timer.
All right. I did hear that he spent $8 million more than the NFL budgeted on his Super Bowl show. It was just a massive.
He must have a lot of coin. He's throwing money at forward. Let's go. Get that timer. All right. On demo, my friend.
Here we go.
Are we going? I can't see it. 3, 2, 1. All right, forward. $225 million in a Series D national expansion. I just listed off the investors. Matthew Holt. Why didn't they just go public?
Well, here's the problem, right? So Forward is a clinic that has this weird body scanning and genetic testing and stuff, and they don't actually ever tell you who their tools are. So they just say, we have this proprietary stuff to doing this. And you pay them a couple of $100 a month. Adrian Allen is the next Google guy as the CEO, and he had some health condition and decided he wanted to get into healthcare. The problem with this stuff is that, the amount of people who really want to pay extra for that amount of primary care, I don't think is that great. So you have to go to the world of employers, and then you're competing with people who charge a lot less in the membership, but do have a sort of membership thing that's pretty good, like the One Medicals of the world and the crossovers. So, this is a tricky late entry, but very techie savvy, and, they convinced, all the pop stars and all the and Softbank. So it must be easy.
I know. All right. What about patient billing company Cedar? They get $200 million. This brings their valuation up to $3.5 billion. Tiger Global Management is in their injuries, and it's like the opposite of the other crowd. What do you think about this one?
Well, I mean, in general, I'm not impressed by the concept, because you have to bill. Making patients billing experience is horrible, but this is really about making money off their late payments. So I'm not loving it, but I mean, clearly it's been adopted by a lot of hospitals very quickly. So yeah.
All right, Babylon making inroads into the U.S. from the U.K. They're buying a California provider group with 80 primary care specialists, 80 primary care docs, and 1,000 specialists in it. What do you think this is? Is this really the play for the U.S.?
Yeah, I mean, so this is exactly what they've done in the U.K. Babylon started a general practitioner, and they added their layer of sort of, symptom checking bot thing over the top. Well, that's our timer up there. And I've got a new phone, I don't know how to switch it off. So it's the same concept. Could you do the same thing with the Medicare Advantage medical group? They started out with one in Fresno in the Central California. They done something similar, I think, in somewhere in the Midwest. And don't forget, they have money into their round. The huge round that came from the Saudis also have money from, I think, Centene came into that round as well. So basically, it's an attempt to, can you do an automation of the primary care function? Now, whether you can do it with people in the Medicare Advantage age group, I don't know, because I know they're not, they're older than the group who's kind of signed up for their things in London. There's been a lot of controversy about whether Babylon works properly or not, and whether AI is real or whether it's fake or whatever. But this is where care is going to go, right? A lot more sort of front end bots, sort of front end symptom checking, and then triaging to get the right people to the right doctor. And don't forget, they're not the only ones, right? So people like Cleveland Clinic have done this with Giant, and Anthem's got a deal with K Health and all the rest. Of Sutter's got something similar with Ada. So yeah, I mean they're coming in, and it's something they've done in England. I would expect them to try a lot more of this, because on its own, a symptom checker isn't enough unless you can sort of show that it causes efficiencies down the line. So it's interesting, it's going to be controversial, and it's definitely one to watch.
Good. Good answer on that.
Thank you, sir.
Ma'am.
Ma'am. Whatever. I'm all lost in the British. People keep on calling me up with the British royal family, and I
think you got confused because I complimented you, and you must have thought for a moment, this can't possibly be.
That must be it. Anyway, that's what I'm about.
Well, that's interesting. Looking forward to learning more there.
Yeah.
Well, yeah. So
by the way, should I be buying Teladoc stock, or has it gone back up too much? We just did a TCB gang, and apparently, according to Ian Morrison, the entire state of California's balanced budget was made off you selling Teladoc stock at a profit and making capital gains.
I don't know about that, but no, I think I don't know. Look at it. I mean, I haven't seen it. I didn't see where it ended up today, but I think where it was yesterday. I mean, if I were in the market for buying more, I would have bought some more. I bought some other stuff. Because, why not? I just think at this point, it's like if you felt like you missed out on a lot of those health tech stocks when they first either IPO'd or whatever and wanted to, they were right back down there. So I told you to buy last week. I was like, what are you doing?
I'm too busy buying that THCB stock, which then went down.
That is not even your confidence. Like, why? Just because it has the letters? Like, these are how you're picking your stocks these days? Like,
well, my
stock. What you know.
my rational stock picking doesn't seem to work for the last 2 years, so I thought I'd do something that was.
I don't know why you're not listening to me. I'm doing great.
All right. Okay. So Mr. Master, get us out of here.
For hot stock tips, you can find me over on Twitter. I'm at Jess Tomasa. And if you know more Weeknd songs that you think Matthew Holt should give a listen to, you can send those over to @BoltyBoy. As always, we encourage you to sign up for our email newsletter over at thehealthcareblog.com so you never miss a Health in 2.0 and find out what's happening with all these health tech companies. And also receive some of the greatest content from the blog for the week delivered directly into your inbox. And if that's not your thing, just go to YouTube, hit subscribe. You'll get notified. It's great. While you're there, find WTF Health. Subscribe to that too. I have some exciting people coming on next week.
Who you got?
I'm not telling. You're going to have to subscribe and find out, people. But
all right.
I've got some exciting people coming on next week. I'm excited.
All right. I will subscribe and find out and watch some of your interviews.
Oh, please. You're already subscribed. You bought in a long time ago.
Okay. Go away.
We'll see you guys next time. Thanks for watching.